Hi, and welcome back to Patient Point of View with Garinia. I got some new stuff in the mail that I ordered to make my recovery go a little better. And I thought I could also answer a few questions that folks had because I'm often getting the question, why, what were the symptoms? Did you get injured? I don't know if I got injured. I had hit my head several years ago. I ended up with a really bad concussion. It is quite possible that I further damaged my neck at that time. And since that time, my symptoms, which include left shoulder pain initially, I thought maybe by swinging, I was swinging on a bar when I hit my head. I was swinging on a crossbar and hit another crossbar and kind of bounced off. And it's probably possible that I damaged my neck at that time. Shortly thereafter, I had shoulder pain. I've had shingles multiple times. I've had ear, nose, and throat issues that seem to get just worse and worse, and also tend to be just on the left side, the side that has the most amount of damage. And then weakness in my hands, pain. Initially, when I had my initial cervical fusion, that pain was very acute. I couldn't move my arm at all. This more has been like a chronic ache that at times can become very acute and disabling. And then the pain down my leg, around my back and down my backside, down to my leg and to the outside of my ankle constantly feels like I have sprained my ankle. That has been pretty severe for the last year. And folks kept looking at my back, my lower back, thinking, oh, maybe it was sciatica, maybe it was this. And being that I already had all this other stuff going on, it was really hard for people to figure out exactly what was going on. If you ask my husband, it's been a no-brainer the whole time, and he's not quite sure why we didn't get the right exams to figure out exactly what was going on sooner. And while I can appreciate that, I also appreciate the fact that it's not always that clear. And so one of the things that did help them come up with a diagnosis was I had a motion x-ray. So basically it's an x-ray that I'm not going to go ahead and do that because that'll cause me pain, but you turn up, you look up and you look down, you tilt your head one way, you tilt your head another way. I think it's like 4 pictures and they're x-rays. And those were I believe the determining factor in realizing the instability of my cervical spine. My local neurosurgeon here was the one who recommended that, and that's why I went through that. She was initially the first one to say, I think you need surgery. That's why I went to go get a second opinion, just to make sure and be in a much larger city environment and city teaching hospital. So those are a little bit of the lead up. So I did purchase this Lingito travel toothbrush because you're needed in the hospital. Hospitals are the noisiest and worst places ever. So I did get myself a little bit of noise canceling headphones. So I'll let you know in nice fun color, nevertheless. I'll let you know how those go. I thought, I like to listen to music. I like to listen to podcasts, kind of zone myself out, especially when I'm in pain. It's really nice to listen to music, and generally, I find single track music, such as just classical guitar playing gently, is very calming. The more layers of music and complexity to the music, the less I can kind of just really calm down. I did get myself some lavender Woods of Windsor from England, lavender dusting powder. I do love the smell of lavender. I also got myself some Human and Kind. I had really good reviews on Amazon, and I just wanted a small body lotion. So this says Body Souffle. It's all, geez. Anyway, so that was in one box. I can't even get this one open. There we go. Just to get a little bit of this. Oh, it smells good. It's nice and light. It's nice and light. We'll see. It's vegan and is, free of animal cruelty. And let's see what's in this one. Oh, cord, because I will need something to keep my phone charged. And I have a very nice, expensive Apple cord and charger that I don't want to bring to the hospital. I want to bring something, hopefully that'll work just as well. I splurged when I bought my phone and bought a nice version of the nice charger. And it was worth it, honestly. I hadn't done that in the past, and I haven't needed to replace it. And I've had my phone a few years, and you know how a lot of times they need replacing. So I did buy myself a little bag to bring to the hospital. Other people had suggested bringing a bag, and then, I know that when you have a baby, you usually bring a little bag. So, Fettinvin, I don't quite know how to say that right, but that's what that is. So again, I'll let you know on any of the products. I'll let you know what works and what doesn't. I don't get paid to advertise or anything like that. I'm just buying what I think will work for me. And since there's not a whole lot there that people have told me would have worked for them, I'll share with you what's worked for me, and hopefully if it helps you out, then it helps you out. There's a strap. And it's just a little bag so that I can bring in lightweight, carry it there. I'll put in my my house coats and some of my toiletries in. Then I got, because I want to be able to keep you all updated, I got this that I thought, because how do you watch TV? How do you, or do anything on your phone in the hospital when you have a neck brace that's like this? So you gotta go like this for everything. So I thought something like this might work. If other people have products that they've used, please let me know, because I'm really guessing in the dark here. This, I don't even know what you call this. This is a LS05 gooseneck phone holder by Lamicall. So, do you want to see it? That's what it is. But it looks like it will. Ooh, that's sturdy. Wow, I thought it would be much looser than that. But this clips on. And maybe it does, maybe it doesn't, maybe it twists on. And so then I thought it could go on the hospital tray, and then I would be able to, wow, it's much sturdier than I thought. Then I would be able to have it hold my phone or do something like that for me. We'll see. We'll see if it works. I'll put that in my bag and bring it with me. But I did buy myself a second option as well. And we'll see if that one's in here. Yeah, see, and one of the other things, I don't know if I mentioned it already. I know I mentioned the pain, but my fingers don't work. So it's really hard to get anything. Can you open that for me, please? So you usually have to ask people, and you just constantly feel like you're going, I can't help you, my fingers don't work. And it isn't like one or two that hurt you too. Not just like one or two fingers don't work for me, but they just, here, you gotta pull that for me. There we go. Oh, I bought a bunch of these because I really like these. But what I liked about these was that these came in these little packages, so I bought them. They're just dental floss picks. So I can take with me some dental floss picks. I hate not being able to floss my teeth when I want to. And I really like dental floss picks because I think they're easy and convenient, and you can usually use the other side to get any kind of other loose food and debris out of your mouth. So that's what I have. I don't really feel anxious or anything. I've got a couple of days until the surgery. Again, I'm really just looking forward to it. I'm just trying to make sure I take some nice deep breaths and try to relax as much as possible. I'm going to ask my husband to take a short video of me after the surgery. Remember that the first day will be just the not a laminectomy, the cervical fusion in the front. I'll be a little hoarse from that. I know that from experience because, you know, they have to move the voice box out of the way to get to where they want to get to. So the first phase should go fairly smoothly. And then I might even be able to record myself. But then the second phase will be a lot more involved. I'm not sure that I'll be able to talk at all. One other thing I wanted to mention is that I'm looking up housing or find hotels and Airbnb for my husband to stay at the hospital. A nice thing that I found out that the hospital does do is it offers in some of the local area hotels, they do offer a discount for relatives of patients or patients going in the night before. Because I don't need to get there until 8:30, I'm going to leave here probably at 6 in the morning and ride out. So I should be there in time. No need to really spend the night. I'm early bird anyway. But that's it. As always, remember to have a patient point of view.